Welcome to the Physio Standard, a global podcast for physiotherapy clinic owners and practitioners who want to lead, not follow. Each episode explores the thinking, systems, and decisions behind world class practices. Presented by Eagle Pro, supporting modern physiotherapy clinics worldwide. Today, we are joined by Dr. Anant Singh Gaur, a neurophysiotherapist and health tech entrepreneur from Bhopal. With over 16 years of clinical experience, he is the co founder of Remote Physios, a startup working to make physiotherapy accessible at home through technology enabled remote rehabilitation. Welcome to the podcast, Dr. Anant. It's so great to have you here.
Thank you. Thanks a lot.
Before I give away too much, I want to ask you to describe your practice and what you do, what you're building at Remote Physios briefly.
Right. So first of all, thanks a lot, Shri Vidya and the team for inviting in this podcast. And I'm working in remote rehabilitation with a vision to enhance remote rehabilitation, just like you can say, just like clinic grade, because remote rehabilitation is a requirement, and remote physio is developing certain tools and technology by which a qualified physiotherapist can give clinic grade physiotherapy for the remote patient from distant location. This is all we are working, and would be happy to share my experience regarding remote rehabilitation.
Remote physiotherapy or hybrid model of care, is that a temporary solution that we're looking at, or is that something that you see as a permanent mode of care, and why?
Uh, right. See, the major problem with physical therapy delivery, or you can say people, those who are in need of physical therapy, the major challenge is continuity. And for that continuity, being a professional, it is very easy for us to say that you have to come to us, or you have to take physiotherapy for 3 months, 6 months, or a longer duration. There are certain conditions in which longer duration physiotherapy is required. It's very easy to say, but just imagine from the patient's perspective. It is really very difficult for them, because they have to come regularly for a physical therapy session. They have to devote time for commute. They have to separate that particular time, and the entire family is involved in that particular sense. If it is for a 10 days, 15 days, or something like that, it is easy. Even if it is once in a week, it is easy. But if you are in need of a continuous care, then there is certain problems are there. So being a professional, we have to think out that what are the other alternative. And in that sense, remote rehabilitation is one of the part that need to be explored with very well, with lots of effort. Why? Because there are certain conditions which require guidance. There are certain conditions which can be managed remotely. There are certain conditions in which even your suggestions or your things will work very efficiently from remote perspective. Generally we miss that particular part. Why? Because we believe either we should visit to a patient's home, or patient need to visit to us. So remote rehabilitation is a need of our, particularly in a healthcare system like in India. Not only in India, if we'll talk about the Western healthcare system as well, if we'll talk about the European healthcare system as well, commute is always a challenge. So to solve the problem of that commute in respect of physiotherapy, we have to think for rehabilitation, remote rehabilitation very well. And it's a necessity, it's not an optional.
So you also mentioned where it is useful and in which cases that this is going to be useful. But I mean, I think you mentioned the some of the gaps already, like need for continuous care, and it's not practical for the patient to come every day. But are there some
Right.
other gaps that you have observed in our traditional physiotherapy practice that you think that the use of technology will fill, or make the process of physiotherapy more smoother?
Technology is changing the entire way of working, even if it is from banking to any part of healthcare or any other industrial aspect. So then why not a physio should adopt those technology to strengthen their system as well? If we'll talk about the documentation, if we'll talk about the exercise prescription, if we'll talk about the proper communication to our patient, technology plays a vital role. Because being human, we do sometime, we are stuck with, our 10-hour working loop. So it is not at all possible for us to work more than 10 to 12 hour in a day. But our patient require a lot of things that need to be delivered on time, and technology can help in that. So it's not about only about remote rehabilitation, but in traditional physiotherapy, yes, everything is base, everything is related to that base only, with the basics of knowledge and all these things. But if you want to develop something scalable, something from which, from a single person or a single senior professional, if they want to deliver their services to masses, to many people, they have to adopt technology. So if we'll talk about gaps, just for an example, if I'll mention that the number of hours a single professional can invest in his own practice, that can be multiplied with the help of technology. And that is how it should be done. That is how they should reach to the many people with the help of this technology.
So it helps them to reach areas that they wouldn't otherwise reach with traditional practices.
Right, very true.
So, having been into remote physiotherapy and hybrid model of care, do you think that this will soon become the standard of practice in physiotherapy and sort of replace traditional physiotherapy where it's only one-on-one?
It is not about the replacement, it is about complementing the traditional or a conventional physiotherapy. It is not at all about replacement, because we cannot replace the things where our maneuver, our clinical skill, our this touch is required. It is not at all possible, but it is somehow complementary. For example, I'll just give you one example. For
Sure.
example, a back pain patient, acute back pain patient is there, or a patient which you think, I'm not just going to name particular clinical condition, let's assume a clinical condition in which you think that 30 sessions are required, and the patient is quite busy, and he's not able to visit you for regular 30 sessions or even alternate days or something like that. He says once in a week I can come, I can manage, but rest of the days it is not at all possible, not at all possible for me. So ultimately, that is a loss of work for a physio, that is a loss of health for a patient, and it's a loss of health for the entire ecosystem. So now, if he is able to come once in a week, or say 4 or 5 days continuously, and remaining session is possible remotely, then it should be opted. We have to find out that way. So in this way, you are able to give the kind of therapy that they require, and from the distant location as well, and they are also managing their oral, their daily activities, daily life, along with treatment, and that's how it works. So we will not say it is going to replace anything, it is going to complement very well with the help of these few tools that I'm going to mention later on in this podcast. So these tools are helpful in creating that third vertical, that third way of delivering physiotherapy, not only by home visit, not only by clinic visit, but there is a midway part in which neither patient need to travel to you nor you need to travel to patient. So this is how remote rehabilitation will work.
That is an excellent answer. I think that, like you rightly said, it does not have to be about replacement. It needs to be about complementing and what more
Compliment.
can we do. And
Yes.
it does really solve the problem of one travel. And realistically, everyone has a job. Everyone goes to
True.
work. They have their daily routine. So coming
True.
and traveling to a center, assuming that there are no waiting periods, just the travel and then the time of the session and then the travel back to their work or home, that itself becomes sometimes a resistance. So it's like
True.
you start, so you're basically creating lesser resistance to offering
True.
physiotherapy and making the patient adhere to their rehab protocol or rehab journey.
Right. So I would like to add on in this answer, that
Sure.
just imagine, sometimes people says that patient is not visiting us because of its charges are high, and they are not able to afford that or something like that. There is not even a single question of affording or something like that. Why? Just imagine a patient require a surgery, and surgeon ask 1.5 lakh rupees or 2 lakh rupees or 1 lakh rupees or whatever the amount is there, patient do pay that amount. Why? Because they know the entire course of treatment. They know that I will go, I'll admit, there will be 7 days of admission time, and then after that I'll be at home. So they can make their mental makeup, or they can thought about it, they can plan about it, they can take the leave or something like that for 7 to 8 days or 10 days maximum to 15 days. It's fine, because that is certain thing that they plan. Now you just ask in terms of physiotherapy that you need to 50,000 rupees for physiotherapy, but you have to come to me for 3 months, for 2 months. So here amount is somehow same, 50,000, 1 lakh rupees, whatever you are asking, but you are along with the amount you are asking time as well. So you are saying that you have to come for 3 months. So that is the bigger lacuna, the bigger hurdle, or you can say bigger problem with the patient. Money is not a problem. That time, daily traveling, daily coming, daily finding out the specific time, that is a big problem. Particularly if it is not necessary. As I mentioned, the present physiotherapy ecosystem is working. If I'll take a pyramid, the top of the pyramid people, those who are using physical therapy, are either in urgency or privileged. Only two things, two type of people are taking physiotherapy right now. If there is some urgency, if there is a severe back pain, if there is a severe joint pain, if there is a recent paralysis or something like that, they will come to physiotherapy daily. They will drop out all the work, they will come, and they are coming to physiotherapy. But just imagine a paralytic patient, a stroke patient, after 6 months, because now the care is long term. Now, just imagine a patient in an underserved area, or you can say a patient who is living remotely. These two part of the pyramid, they are ultimately deprived of physiotherapy. So we physios are working at top of the pyramid and saying our ecosystem is, you can say, got plateau, number of patients are enough. No, it is not like that. There is a large number of patients, those who are deprived from physical therapy, either in long term care or underserved or remote areas. They need be to have some certain system or certain technologies or certain process by which we should deliver physiotherapy to that particular part as well. Then only we can say we are delivering physiotherapy to all. So this is a major part that need to be considered.
I thought about it in this way that who gets physiotherapy? And you put it
Right,
really in a crisp manner, saying that the people who can afford, the people who are privileged, and the people who are in urgent need, those are the
right,
only ones that are currently getting physiotherapy. And we are missing out on the people in remote areas, tier 2, tier 3 cities who don't always have access to physiotherapy. So we're missing out on that group. And that
right,
accessibility is what you're aiming for in your
right.
center. In this scenario, how do you how do you plan your assessments? And let us say that if it's a remote situation, how do you maintain the accuracy of the assessments in that situation?
Yes, here comes the technology. Here comes technology. What we do when the patient is in front of us? What we do? We generally assess the range of motion. We generally assess the tone. We generally assess the functional activities. These are the things which is very crucial. Now, just imagine if 80% of these things are possible with the help of camera of a laptop, or camera of mobile, or camera of tablet, with the help of camera vision. Different type of camera vision technology is prevalent, or you can say it was mature in 2020. Since last 5 year, the fitness industry is using it. We should need to, customize that particular thing as per our need. Just for an example, in terms of assessment only, we know that our camera, this camera vision can calculate that how much degree of angle that particular that joint is moving. That is possible. So range of motion is easily able to assess. The major problem comes, that is with the palpation, or wherever a manual touch is required. So whenever we take the history of that particular patient, we come to know whether that patient is completely suitable for remote rehabilitation or not. If there are red flags, if there are certain things that need to be examined before going ahead, then definitely the patient need to visit to a clinic. Now just imagine, I'm never a promoter of a complete virtual ecosystem. I'm a promoter of phygital system, in which physical and digital is a combination. So for example, that's why the remote rehabilitation or the remote physio, my company is working to empower physios so they can strengthen their practice in their local area. Just imagine a patient who is who is running a clinic in a certain area and want to deliver at the best of his service to that particular locality or the nearby locality, or as per his appetite, to that city or nearby area of that city. They can do that. Why? Because patient can travel to you. If you are 100 kilometer away, also patient can travel to you once in a month. That is possible. Or for first assessment, he can definitely travel to you. But after first assessment, if you'll say you have to stay for 10 days, if he is a farmer, the it is not at all possible. If he is the only earning member of that particular family, not at all possible. Now the rest of the things can be done remotely. If you feel that okay fine, you have to do certain exercises, that exercises need to be monitored, you have to get through with some kind of equipment, for example TENS, ultrasound, muscle stimulator, and all these things are required, that can also be controlled from remote location. That's what we are developing. We are developing IoT enabled devices, so that's why these devices can be controlled by a qualified physiotherapist from a distant location. So a physiotherapist in his locality is empowered to deliver physical therapy to the patient who is not able to travel to your clinic, to his clinic. So that is how we are doing. And regarding assessment, it's totally depend on the acumen of that particular physio whether to take that patient in telephysiotherapy or not. As per the guideline of telemedicines as well from Ministry of Health, it is also they made responsible to the professional only. If you are saying that I am going to treat this patient via telephysiotherapy, then you are responsible for that patient. So you have to choose your patient very wisely whether it is suitable for telephysiotherapy or not. If you think that certain type of test is required, certain type of investigation is required before commencing physiotherapy, please do that. Never ever take a shortcut, because technology is enabling you, so you can just fool your patient with the help of technology. You will be in trouble. So you have to take your clinical acumen to decide whether that particular patient is possible. Yes, in remote physio, we are trying to develop tools so the assessment could be as real as possible from the distant location. It is not a matter of a day. We will take definitely our own time. We are developing with certain type of sensors. We are developing certain types of algorithm. We are developing certain types of camera vision technologies. So from distant locations, physios can visualize, can imagine what is the clinical condition of that particular patient.
So, like you rightly said, there is a category of people. So there has to be like an eligibility criteria that you set
Yes.
for
Yes.
the who is eligible for remote
Yes.
physiotherapy and who needs a hybrid model of care or an in-person care. Have you, in your experience, seen certain patient groups or groups with these certain characteristics do well
Hmm.
with remote physios in your experience?
Yes, education plays an important role. If people understand technology, that group really do well. And honestly speaking, we do have lots of resistance in initial session, because still it's a kind of adaptation. Because people do believe that physiotherapy is possible only when some physio is coming to us or we are going to clinic, then only physiotherapy is possible. So whenever we are going to propose this thing, okay fine, just for an example, I would like to take one example of my friend only. He's a corporate employee. He was passing through my clinic daily. He's having tennis elbow, and because of tennis, that tennis elbow pain is bothering him, but it is not that much severe. As I told you, urgency and privilege, these two are the parts. So it was not that much urgent to visit my clinic. So he is passing through my clinic by 9 a.m., and by 7 p.m. he is again passing through, but 9 a.m. he is in a hurry to his office, and by 7 p.m. he's exhausted, so he's not visiting. He always say, whenever we talk over phone, he always says I am having little pain, and that's how it. So I simply suggested, okay fine, just take this ultrasound at your home. My physio will take care of you by 7 a.m. in the morning. When you do your regular exercises, my physio will be there. So my physio was there, and that ultrasound session was done. remotely with the help of this remote physiotherapy, this IoT enabled devices. And then after that, regular exercises were there, 15 sessions done. All together things are done along with the exercises and all. So that is how you can see a patient adopted, and he himself recommended more than 5 patients. He himself recommended because he knew that time is a money. So he didn't buy physiotherapy from us. He borrowed the time. He borrowed the time because time is the convenience for him. So 7 a.m. in the morning, if session was scheduled, all the exercises were done, electrotherapy part was also done. He is more than happy. So that is how you can see it is a kind of, yes, people those who are struggling with, for example, elder group, for example, the people those who are having little, little knowledge of technology, yes, they do struggle with this type of thing, but it's our duty to make it simpler. It is not their duty to to learn new thing to get the treatment done. They are having their own lifestyle. So it's our duty to make things simpler and simpler, so even a person who is in remotest location, even a person with little understanding of technology can also use it. So that's why we are evolving, and that's why we are adopting.
So then you would say education plays a major role, and
Yes.
remote physiotherapy works, or basically it is about reducing the resistance towards taking physiotherapy. So, in a
True.
sense, that you are also catching it earlier. So, in the same example of your friend who had the tennis elbow, if we
Hmm.
had left it up to him that he'll come when it's severe, then it would have actually become severe. But by
Yes.
catching it early and doing the
Hmm.
physiotherapy earlier, and not just doing doing the physiotherapy earlier, but we also understood what his requirements were, and then
Yes.
created an environment for him which was conducive, which made it easy for him to get the
Right.
physiotherapy done. So because of
Right.
that, he's probably prevented some more pain, or probably leave from work, or reduce
Right.
participation of activities which would have happened in the future.
Right. Just another classical example is with the females as well. Females generally develop the muscular aches and pain in an initial time, and gradually, because of some deficiencies or because of some overwork or whatever it could be the reason, they may develop some kind of trapezitis, they may develop some kind of overuse syndrome or something like that, and gradually they ignore it because daily course are there, that they are not, they never think about it that I should go for a physical therapy or something like that. And gradually that type of overuse or trapezitis or any deficiency or any reason of muscular pain become fibromyalgia. And then after that we say it's a chronic problem, it's a chronic problem that require a lot of time to recover. You just imagine if that type of overuse syndrome is there or a kind of trapezitis is there, if that can be addressed at the earlier stage, females those who are housewives or something, they are living at home and they are having an option, I can connect with my physio for these aches and pain, and I can address those pain in earlier time. Definitely the chronic pains will be less, the burden of chronic pain will be less. So that's how we have to penetrate deeper with the help of technology. We should not wait, patient should come to us. We should find a way so patient should feel comfortable and can find us anywhere where he is convenient.
Excellent, excellent. This is not a way of physiotherapy that I had thought of, and it has really opened my eyes to a different perspective. Some physiotherapists may think that if I go remote, then my in-person patients or the numbers may be diluted. So, what are your
Hmm.
thoughts about that? And if that is a reality, then how do they overcome that?
They will get more patient if they adopt remote physios. If they get remote rehabilitation, they will get more patient because they are getting, their patient get lost because of this daily travel and all these problems. Because right now the physios are giving only two option: either I'll come to you or you
Or
come
you
to me.
can correct.
So we are giving the third option: neither you come nor I'm coming, but your treatment will be done. So that is how this their patients will be enhanced. But once again, as the entire ecosystem is divided into, quality care and in-person care, at home care, and all these things, each and every segment has their own importance. Each
Right.
and every segment will be delivering their way of the treatment that is required. Remote rehabilitation is a need of our, once again I'm saying, I'm looking forward for the people, those who are deprived, those who are not having access to physiotherapy. At least they can do that. They can. Just imagine a patient with a geriatric problem. Just imagine. Acha, one more example is there. Just imagine a patient of cancer post cancer rehab. They are more susceptible for infection if they are traveling to clinic. They are weak enough to travel to a clinic. So what are the ways by which we are supporting them? If we are traveling to them, then also the chances of infection are there. So remote rehabilitation could be an option for them. Another example from the physio side. Just one another example, like female physios. Physios, those who got married, those who don't want to go for home visit and not able to start clinic. Just imagine, their practice is gone. We are having n number of cases, n number of situation where female physios generally lost their practice just because of the scenarios, because they don't want to go for home visit. It is not that much feasible, and they don't want to start a clinic as well. Now just imagine, if they are having these equipments, these technology, they can start their practice from their drawing room. They can take care
Right.
of their patients from their drawing. So it's a win-win situation. Technology is always an adapting. We need to adapt it, we need to understand it, we need to utilize it for our own benefit without compromising the present situation.
You're very right about that scenario where, physiotherapists sometimes will need flexibility because of family commitments, and because they need
Right.
to also give equal time to their family. And remote rehabilitation offers another alternative pathway where you can choose your hours. There are some flexible times, and you can do it from your home. There is no commitment to go to different places, travel, and come back, and there is no commitment to a center and maintenance of the center also. So this
True.
is a very, very viable option for physiotherapists
Mm.
as well. It's great. So if somebody wanted to adopt, like a physiotherapist wanted to adopt a remote physiotherapy into their clinic operations now, how how do you think they should do that?
First of all, they have to change the mindset. They have to adopt it from their mindset. Yes, they have to believe it is possible, first of all, and they need to learn. They need to start with a simple thing. The simplest thing could be suggesting their patients with a simple consultation, not going with a complicated, just like electrotherapy and all these things I'm explaining right now. No,
Yes,
no need to go from day one for those things.
right.
Just start doing certain video consultation with their previous patients, or the past patients. Try to understand their present problem. Try to understand. Let's schedule some session of 10 minute or something like that. Try to talk to them. Once they start doing that, their past patients, or the patient those who got some 50% relief or 60% relief when they were coming to clinic, but because of some reason they stopped it. Once you start talking to them over video call, or one or two exercises they are going to explain you with some focus, they develop a trust. They
Right,
develop a trust. My
right.
physio is thinking about me. My physio is trying to help me. So here comes the empathy. And then after that they will trust, and they will ask you, sir, can we go for regular session by this mode? Now the changes, entire thing has been changed. So you can do a lot of things by changing the mindset, starting the momentum with this initial self-paced activities or exercises, and gradually you will find you are doing full-fledged your these things very well. Because here what is the requirement? As I told, the bottom line is connection with the patient and the continuity of care. This is the two bottom line. If you are able to manage it, everything is done.
So you would say that the first practical step to starting remote physiotherapy for any physiotherapist that who wants to start would be to simply start through a video call, or believe in it and talk to the patient about it. And
Right, right. And gradually, we are coming out with one few of the courses as well for this
Mhm.
telephysiotherapy, so that will help the people to understand. And one more important thing, apart from the courses, self-learning is the best thing. Self-learning,
Right,
learn from your experience. So just talking to your patient over video call, giving them some basic treatment. Once one fine day, you will find that you are doing magic over the video call. So that is how it will work. So that is the main thing. Yeah.
right, right. How do you train your physios to follow a systematic approach and deliver outcomes consistently?
Right. It's a continuous learning process. Each and every case tells us something different. Tells us something different because when we have taken care stroke patient as well, the musculoskeletal pain are there. Even for stroke, the major challenge was balance and all these things. If any fall or any injury or something like that, that will be a very troublesome to lay out the system, to lay out the entire environment. So it should be safe. Even in case of fall, there should not be any injury. These are all part of the SOPs and all. How come? Because whenever you are trying to give something to client, you have to safeguard yourself as well. You have to understand your limitation as well, what things can be done, what things cannot be done. So each and every case study is a learning part, and each and everything while we are trying with a patient taught something different, entirely different. As I told you, tennis elbow patient, ultrasound. Now just imagine if I'll say someone that a patient is doing ultrasound by himself, but the control is with the physio. So how patient is doing that circular movement and the targeted movement, that is a part of training to a patient as well. That it is a part of, so patient should do it somewhere without that machine on. They should get it done without machine on, so the patient will be learning that particular process, and then when the machine is on, they are mimicking the same thing. In a similar way, physio should understand what are the things need to be delivered or need to be communicated to patient as well. How come? Just I'm just giving you one example. If suppose physio is not at all convinced that they can help patient remotely, the this psychological things will be transferred to the patient, and the entire session will be gone. If physio says, okay fine, I want to do this thing but it is not possible over here, if you are in front of me, I'll be doing that thing, a single line, and the patient is gone. Patient will never trust you, because what he will understand, that I am getting some under deprived
Lesser
things of,
quality of
you can say, lesser quantity of treatments or something like that. So the kind of communication that you have to tell to your patient, and the most important thing is that what is the target of these physical therapy, what are the outcome that you want to get, and that need to be quantified. Even in our clinical practice as well, we generally divide the milestone in such a way that the easier milestone should be the first. If you can divide the entire recovery into smaller milestone, the patient will be confident, because patient is paying you for something that need to be delivered. So if you are not able to quantify that thing, then it is not at all possible. It is not, even if you want to take care of that subject for 6 months, it is not at all possible that you are going to take care without dividing the milestone into 6 milestone or 12 milestone or something like that. So these are the parts of training to a physio, how to communicate, what are the things that need to be done, how to document, what are the exercises that is possible. So it should be, and how the things are, because you are in front of camera, you are not in person available over there. So what are the strength? First of all, realize the strength that you are monitoring them, and how the movements need to be just, so it is not at all possible. And apart from that, one more important thing, that we are developing a hierarchical system as well. In
Mhm.
remote physio, there is an operator, a junior physio who is going to operate, because one more important gap that I told you earlier is the per hour cost of a senior physio. Just imagine, everyone wants to get the treatment done from a senior physio only, but that senior physio is having a limitation of time, and his per hour cost is high. While if we'll talk about a junior physio, his per hour cost is low at initial phase of time. Initial phase of time. So that junior physio could be an operator who is in front of a camera. The entire treatment protocol is by a senior physio. So the patient is in continuous care of a senior physio. Entire protocol, what senior physio decided, is delivered, monitored, and supervised. So per hour cost is justified here. That's how the things work. So this is what remote rehabilitation we are doing, and this is how the training part works.
Excellent, excellent. I from your answer, I think I have a couple of more questions that I'd like to ask you. So the first one is we were talking about patient safety during these sessions. Also, you touched on that. Uh, let's say electrotherapy, yes, like you said, you can train
Yes.
them during an off time and they can apply it on their own. And also, there are many home kits now that patients also purchase by themselves. So that's sort of become a own use sort of modality these days. But what about exercises? Is there like any criteria that you follow that exercise safety is maintained and there is no risk of fall or risk of injury during exercises?
Yes, very true. First of all, I would like to correct the first part of electrotherapy. That
Uh-huh.
is a big problem statement that patients are buying home kit for to get the treatment done by themselves. I
Oh.
observed this thing 2 years before, and since then we are working on kits. We are working on IoT enabled kits. Now there is a difference between the on electrotherapy on which we are working and what is available in market as a home kit. Our kit is in complete control of a qualified physiotherapist. Means once you will start a laptop, once you will enter the button, then only that machine will be started.
Mhm.
You can decide the intensity and protocol from your laptop, and that
Mhm.
intensity, that frequency, that type of current will be delivered to patient cannot take the treatment by themselves, because electrotherapy is just like medicine. It's a tool which is equivalent to a medicine. If we want to modulate pain, tense is required. If we want to stimulate muscle, stimulator is required. For deeper muscle, IFT is required. For soft tissue healing, ultrasound is required. These are the four equipment which is essentially used in each and every cases somehow, and it's a part of clinical therapy system. So just imagine if we are giving a electrotherapy to a patient and asking them to use by themselves, it will be a blunder. It will be completely, it is not going to support anything. But that device is at patient home. But whenever a session is scheduled and that device is in complete control of a physiotherapist, so now the session is completely in control of a physio, and physio can deliver the similar type of treatment that he's supposed to give in a clinic. So our devices particularly that we work, that is a patented work that we are doing is IoT enabled physiotherapy devices. Now come the second part of exercises. Yes, safety maneuver is only possible with the help of education, by assessing the environment. That's why camera is required. Assessing the environment, selecting the suitable place for exercises, selecting the suitable starting position of exercises as
Mhm.
per the condition of that particular patient. Now there is a third eye, as I told you, camera vision. And what remote physio is doing, remote physio's camera, that laptop software's camera, can analyze the movement, what frequency, what velocity, what range of motion, what is a pattern, what is a pattern. And with that assessment, the data will be coming to physio's dashboard. So physio will be aware that my patient did what kind of exercises at what amplitude. So that is how the entire data is transparent, and physio can take care the next call very well. And the fourth important part is our clinical EMG. EMG
Mhm.
is a small device that records the electrical activity of muscle and gives a clear picture of muscular strength and the other ailments as well. We are developing first of a kind wearable EMG that you can drop to patient home. You just need to target on the muscle on which you are working. You can get the EMG graph at your desktop. So whenever a patient is doing exercises along with the EMG, you can get that report at your desktop. So that is why I'm telling you, with the help of technology, we are trying to make remote rehabilitation as much as accessible as possible with the help of these. And for most important thing, we want to make it affordable. Why? Because if the technology is good and if it is very costly, then adoption is once again it will be low. It will be
Yes.
limited to high end clinics only. It will be
Yes.
limited to the corporate hospital only. But if technology is good and if it is affordable, the masses will adopt it. And if they adopt it, patient will be benefited. That's why I told you the second and the third layer of pyramid. long-term rehab or underserved area. That is possible with the help of affordable technology only.
Are there some metrics that you use to measure the effectiveness of remote physiotherapy? And what are they if you use them?
Yes, there is always some KRA and KPIs. So those KRA and KPIs are related to the adherence of patient and the functional outcome of patient particularly. One more thing that I would like to emphasize for remote physio in this context, in this answer, is we have a progress tracker for patient, caretaker, and physio. So each and every case is having three tracker. One tracker is with physio, so he is giving the feedback or the outcome based on his or her clinical experience. Patient is giving the feedback of on the basis, not feedback, simple feedback that session acha tha ya bura tha. It's not something like that.
Right.
Feedbacks are based on with a certain 4 or 5 questionnaire, and the similar type of questionnaire is with the family caretaker as well. Why
Mm.
it is so? Because there is a psychological thing is that patient generally hide their actual progress in order to get better treatment. It is it is in our clinical practice. Patient generally say, okay, fine, pain come nahi hua. There is still pain is there. So someone took extra care or someone do some extra effort to get rid of that particular pain. So generally they hide sometime. It's not always. Sometimes they hide the actual progress. But the care partner or the family member is the right person somehow, because they observe, okay, fine, he or she was having pain while walking. Right now they are walking very well, better than before. So you can correlate the three database, three feedback: physio feedback, patient feedback, and care partner feedback. Now you can get the clear picture. Now you can get a clear picture what is the exact status of patient. And apart from that, in this we are creating a feedback AI assisted feedback loop mechanism as well.
Mhm.
Because AI assisted feedback loop mechanism, what it will do, for example, if we are giving some electrotherapy to a patient. Right now, in our conventional practice, generally we give electrotherapy treatment, we never record. Somehow,
Mm.
if someone using some kind of software also, they will put down 10s, 20 minute or something like that. They never record the exact parameter, what
Parameters.
frequency, what duration, how much duration, what type of phase, by that is a this trapezoidal, or what type of current that waveform was there. They never
Right.
record that. Now just imagine if we are giving a treatment in which the devices are cloud controlled and data is automatically saving, and it is linked with the feedback as well. So for example, for 10 for ultrasound, tennis elbow, conventionally we learn 1.8 watt per centimeter square or something with the evidence based practice. Now we are getting a real time data that this type of parameter will be useful in this type of condition very well. So this type of feedback loop mechanism we are creating, so it will help in researches, it will help in evidence based practice. So that's how technology will come. It is not at all possible to manually populate or manually this analyze those data. It is not at all possible, but with the help of this type of feedback loops, definitely we can do that.
Yes. And I think when you have this sort of a feedback system along with the
Hmm.
parameters recording also, so what was
Yes,
done and what was the outcome of that? So that
right,
gives you a population level data.
true.
So, one, we'll have population level data, which we don't generally have. We rely
Hmm.
on other
Books.
population data, books,
Uh-huh.
and
Hmm.
European or
Yes.
Western countries data that is available. So,
Hmm.
this is definitely going to help us to get that local population data, and I think we'll also control for outliers and uh, those that don't fall within the norm of
Yes.
this is like tennis elbow means this is how they usually present, but there will be somebody who else who presents in a different way and we'll know what worked for them. So
And
that way, yeah, we then develop a protocol or we then develop a guideline that is unique to us by
yeah,
collecting
very true.
data.
True. And
That's
you can
great.
just simply say that the body structure of Assamese is entirely different, and the body structure of the plains over here is entirely different. The tennis elbow problem or your wrist drop problem for an elderly will be entirely different, and wrist
Mm,
drop problem or tennis elbow problem somehow will be entirely different for a young person. So it is entirely different things. So we have to create certain data sets where we can definitely analyze all these things. So right now we are fortunate enough to live in an era of AI where data analytics is in quick of just blink of eye. So we should utilize that. That's what technology plays its role.
So, from a business perspective, like you said, the care has to be effective. That's what our profession stands for. But it also has to be affordable. It has to be affordable for sure. But
Mm.
at the end of the day, this is our livelihood. So,
Yes.
how do we balance the three, where it remains profitable as a livelihood to the physiotherapist, but it is also effective and affordable to the patient?
Yes, I would like to answer this question with a simple example without technology. And this question I used to ask myself or ask to many people before this technology and all these things as well. You can say 10 years before. 10 years before. Uh, just imagine two scenario. You are taking care of two cases regularly in a month. Two cases are there. One case is of Parkinsonism, another case is of stroke. And you
Mhm.
are taking 25 visit to this particular patient, 25 visit to this patient, so total 50 visit. Just for calculation purpose I am giving this number. It is not, it is less number, but just calculation purpose. 25 visit to this patient and 25 visit to this patient. So how many patient do you have? Only two.
Two.
But just imagine if we are going to convert the care of these two patients, because these two people require a long term care,
Yes.
into a weekly visit or into a twice in a week visit. So from these two patients, you will be having 8 visits only.
Yes.
But if you could have 10 patients, and that too on a bi-weekly basis, then the number of visits will be higher and your reach is higher. And
Yes.
your once your reach is higher, the the repeatability of the patient will be higher. So here is a big lacuna. Generally most of the physio set in a trap of less number of patient with number of higher number of visit,
Visits.
because they are taking care of less number of, they are not free from those patients. Because some elder patient, some physio is doing home visit and he got an elder patient, he is traveling daily, so he is putting his entire 6 month or a year for single patient.
Right.
He may be, economically he will be getting that much, but for future perspective, he is not getting new client, new patient. And ultimately, and this is a service industry, ma'am, it is very difficult to please a person on a regular service basis. So once you are taking care for a long term care, one mistake, he will kick you out. One mistake, he will say okay fine, we find someone other. So your practice should be dependent on many as patient. So here comes the affordability part. If you are going to increase your reach with the help of technology, and if you are going to reduce your amount, and if you are going to use your time exponentially, you
Right.
could be in a better position, economically better position. So it's a mindset of, once again, how we are utilizing. I always call it my per hour cost. I always call in that way. What is the cost of my 1 hour? So
Mm.
I have, if I'm doing a work, it is sufficing my 1 hour cost or not. If it
Right.
is not sufficing my 1 hour cost, I'm not going to do this work. So
Mm.
that is how we have to work. We have to do that particular work. So if in that 1 hour I'm taking care of one patient, I'll charge 7,000 rupees. If but it is really impossible, patient will not give you. So I
Correct.
have to find out a way for that particular 1 hour. If that 7,000 I can compensate for that particular technology, if I can compensate, I'll be doing that work. So this is how it works all the time. So this is something that need to be thought of. It's something different, different thought process. But what I believe is that if you're going to increase the number of patient in your in your database, it will definitely increase your practice exponentially. This is what I
Right.
believe.
When a patient comes to a center, physio gets them to do some exercises or the physiotherapist applies an electrotherapy modality for them, right? But in
Mm.
a remote physiotherapy scenario, um, the patient would be asked to learn how to apply the electrotherapy modality or learn how to do the exercises with the help of visual or audio cues and do it on their own. So, for me, that seems like there is an additional learning from the patient's side. Do you think
Yeah.
that that forms a barrier for the patient to accept remote physiotherapy?
Just make it very simple. For example, we do learn that electrode placement of tens is based on this principle or that principle or something like that. Why to teach those principle? Once you examine that patient, just give them mark A, mark B. Place your electrode on mark A and mark B. Done. You just sit and relax. Now the rest of the thing will be done by a physio. Similarly, for the exercises, don't do anything. Start your camera, be in front of your camera, whatever exercise prescribed, do it. So that is how you have to reduce that particular learning curve and make it as simple as possible. And apart from that, yes, another thing that we are introducing is learning literature. So the electrode, the prescription chart, the PDF of prescription is having already having this electrode placements and everything customized to that patient. So they need
Mhm.
not to bother about, okay, fine, I am having back pain. Just for an example, a patient is having back pain, and if I find that, okay, fine, these are the tender areas or these are the muscles where I need to place this tense over there, just mark A and B. For you, this is a prescription. This A and B where need to be marked. That's it.
So this way you've reduced the barrier by making it customized for these are the electrode placement areas, and then that stays consistent. And then
That's
there's a visual cue of the exercise, and then you see the exercise and you do the same. Now you are very much into technology. And how do you see AI and technology shaping the future of physiotherapy?
it is developing like anything. It is, you can say, every week we are observing an update. A year before we planned for some AI interventions or something like that, so we were working for some basic models or something like that. But right now this is evolved like anything. We initially we were thinking, okay, fine, just give text to speech or something, so it will be convenient for physios to write down. Right now,
Right.
it's not limited to text to speech. You just narrate the patient symptom, the AI will develop the entire protocol, and you just check it out, edit it, and get it done. Get it done. So, in if you're saying the future, AI is a better tool, but that need to be customized. AI is a better tool, but that need to be taken in terms of how well assistance you can take from it. Your clinical acumen will remain same. Your clinical acumen will be higher because you are getting a faster assistance. So you will be observing very well. You are utilizing your, just I told you, per hour cost. So you can increase your per hour cost with the help of these technology. And in future, you can clearly observe that travel time will be very less. Particularly travel, this travel things will be very less. People require convenience right now. पहले के
Right.
समय, earlier it was like that business of roti kapda makan, that is a, means the three industries were there when
Yes.
either food, either housing, or that clothing. These three industries were there, that was the basic necessity. But right
Yes.
now one more thing is evolved, that is convenience. That's why Zomato is there, that's why other Blinkit is there, that's why these things are there. So that convenience people require in physiotherapy as well. So you have to develop those things, including your acumen, including your clinical skill, because you cannot skip that particular part. So AI and this future is quite exciting, and that will open up a door of lots of investment. Because a 5 year before, I still remember when we were talking to investors or some other people, they always says that ticket size is low in physiotherapy, so they were hesitant to pay. Because what we were presenting that we will start some clinic, we will take care of those patient, this patient and that patient. They still, when we do the maths, and we were very aware about that, whenever we doing that maths, we came to know, okay, fine, this either we need to invest a lot of money, Then only we can get that much thing. If we are going to invest a smaller clinic or something like that, the maths won't work. But right now, with the help of technology, this ticket size is quite high, and would proudly say that in last 1 year, remote physio is able to generate 1.75 cr in grants only, so to development of this these things. So people are understanding the value of technology, and how it will be helpful in physical therapy, and physical therapy is required, everyone is admitting that. But
Right.
this can investors are pulling out just because ticket size, they are not able to see their exits, they are not able to see how to make it 10x or 100x, and the other people are ticket size are always a problem. So that's why we have to solve this particular thing with the help of this, with the help of this.
Even with the use of technology, uh, a lot of this technology still serves the top two portions of the pyramid, like you mentioned. So I
Right.
think you've rightly caught the bottom two portions of the pyramid, which
Yes.
require and do not
Yes.
have access to care.
That
So,
is the main aim. That is the main vision of remote physio, to
mm,
cater those people, because serving to top of pyramid, many solutions are available.
right,
Many solutions are available to serve the top of the pyramid, but to serve the bottom of pyramid is the problem statement that we want to carry forward.
right, right. So, to somebody who is, a fresher, a student now watching the podcast, and they want to be ready for a future in technology-driven physiotherapy, what should they learn now, or how should they be better prepared now so that they're ready for the future?
First of all, they have to learn the basics. The principle of physiotherapy will not change if you are using technology or not using technology. First of all, you should be clinically versed, that you can take care of that patient very well. You should have a good clinical skill. Then only it is possible, because using technology remotely require a different level of acumen and experience. If your basics and if your clinical skill is not optimum, it is not possible to take care remotely, because you have to observe a lot of things during this video calls and all these things, because you have to observe the facial expression as well, you have to observe the range of the movement pattern as well, and apart from that, the kind of frustration, the kind of challenges that patient is having during this video call, that also need to be addressed. So first of all, try to learn the basics as much as possible. Institute is meant for this, clinical trainings are meant for this. Once you are sure that okay fine, I'm right now, I'm good in clinical, which generally I'm also not right now, I'm also learning, each and everyone is learning. So once you are confident enough that you can take care of patient, start with the basic things and gradually enhance your scope of work. And particularly the specialized works are there, as I mentioned, COPD, asthma, cardiac rehab, these things can be done very well with the help of remote physiotherapy, because it require vital monitorings and all these things, that is possible with the help of the sensors and all which is available right now. And apart from that, the stroke care, Parkinson's care, those who are require multiple sclerosis care, and particularly the cerebral palsy would like to address that. One of my CSR project is there, in which 1077 patients are registered with neurological insult, with a single aim to train a family member. Our aim is very clear during, and all those cases are on video call. We are just training their family member to take care of their patients for the activities. I'll show you some videos, I'll share some videos with you. People are doing farming, people are doing the dusting of home as a part of exercise. So this is
Excellent.
all together by training their family member. These activities are relatable, and patient is capable of doing that. Make it happen during your daily course. That is how we are doing.
What is the one major transformation that you predict for the physiotherapy profession, let's 10 years later, let's say by 2036? What do you think will transform then?
Larger inclusion in public health. Public health is a part, because whatever we are talking right now is not at all possible if public health is not supporting, and public health is governed by government part, NGOs part, and the other part. Even if we want to give with the help of technology, we want to give remote rehabilitation to the remotest place, unit economics will not work. But if public health is involved, then it is possible. So we are proposing a lot of thing to the social justice department, like we are saying, why disability certificate? Why not ability certificate? That physios are capable of. Just imagine a patient with cerebral palsy or spinal cord injury, department or the doctors issues a disability certificate, 70% disability, 50% disability, and
Yes.
that never reviewed. So just imagine if a database is managed, if technology and AI is capable of managing the progress of that particular patient, every year an ability certificate could be created that this
Excellent.
patient is capable of these things. So according to that ability certificate, you can select for Paralympics, this subject is capable of doing that type of sports, let's start training of that sport. That patient is capable of that type of job, let's connect with certain corporates who is in need of that type of job profile. So that is how
Excellent.
ability certificates could be done. So that's what I'm saying, inclusion in public health with the help of this technology, and all these things are that we are looking forward. And the real growth will comes when we are going to adopt it, and when we are going to prove them that okay fine, this is how a physical therapy assessment or an eye of a physio can also work as equivalent as their hands. So this is that we are looking forward for 2035.
I think that's the takeaway. Eye of the physio is going to work as well as their hands. That's
Hands.
excellent.
That's right.
Yes,
Right.
yes. So, taking from individual and creating a larger public impact.
Mm.
That is what we are talking about. That's excellent. And this conversation, Dr. Anand, has been so insightful and
Thank
has
you.
given me personally a wonderful perspective. And I hope that all the fellow physios who are listening to it will also gain a lot of insights from you. This was a wonderful session that we had with you today. And thank you
Thank
so
you.
much
Thank
for
you.
joining us.
Thank you. Thanks a lot. Thanks for the opportunity. First of all, I would like to say that thanks a lot for that. Right.
Thank you. Thank you, sir.